Good day, nurses. And today I am so excited to share this video with you on how to pass your CCRN exam in 14 days. Yes, in 14 days, you've heard it right, with 3 nursing jobs and school. So it was a very challenging experience, but then I have succeeded, and if I done it, then you can do it too. Okay, so what is CCRN exam? CCRN certification is a board certification granted by ACN. It validates that a registered nurse has achieved a level of knowledge in nursing necessary to care for patients in the acute care. Once again, it's for acute care and critical care settings. This is for nurses in the ICU. This certification is for nurses who work in the critical area. So CCRN means critical care registered nurse. In summary, I always tell myself that this is the NCLEX for critical care. All right. So what would be your adult CCRN certification requirements? Candidates must complete one of the following clinical practice hour requirements. That's the basic requirements that they have. You have to have at least 1,750 hours in direct care of patients who are acutely or critically ill. That's the 2-year option. And the 5-year option is a minimum of 2,000 hours in direct care of acutely or critically ill patients. So if you have other questions or clarifications, then go to www.aacn.org. That's the American Association of Critical Care Nurses website. Now, if you're an AACN member, then all you have to pay is $245. If you're a non-member, then you pay more. It's $360. Adult CCRN test plan. This is the blueprint of the whole test, and this is the breakdown of how much questions per each concept would come out. And to sum it up, you have to use your critical judgment or critical thinking on how to apply your knowledge on all these concepts into the test questions. And also remember that 20%, that's a big percentage also, that they're going to test you on how you take care of the patients. How do you provide advocacy for your patients? What's your caring practices? This is very important. Always remember to study this blueprint so you can be successful in this exam. Now we go to your planning and preparation. Always remember, if you don't have a plan, then you already failed. Preparation. So how do I prepare for an exam? Now, number one, copy this link and go to this website. It's vark at varklearn.com, and then you get to assess what type of learner are you. So that's what I recommend to my friends who are taking any exams, any nursing exam, and to my mentorship also. When you get to that link, it will give you an overview of what type of learner are you and which area can you learn faster, which type of learning materials can you use. So that's a very good analysis of what type of a learner are you. Go to this website, It's for free, so you don't have to pay anything, and you get to know what type of a learner are you. Second, I always suggest that that you use one book at a time or one reference at a time. Stick to it, finish it before you read another book. Now that I've learned that I'm a an audio learner also, what I usually do is I convert YouTube videos. I convert that video into MP3, and then I save it on my USB. Or sometimes when I'm reading my book, most of the time, if I read my book, I read it aloud, and then I record it on my phone, and then once again, I save it on my USB. So most of the time, like me, I'm working three nursing jobs, and I usually spend like 30 minutes to an hour in my car. So what I usually do, I play what I've saved in my USB over and over, and um, that's one of the fastest way that I learn. Number four, you always have to have a big plan. So for my CCRN exam, I plan to study for 14 days and 14 days only. Now, my plan includes on the first week, I have to read, listen, write, read again, my resources. So I have a book that I've studied. I have to finish that book. I have to listen when I'm driving, and even on my downtime, I used to listen to my recordings, and I also write it down. I write it down on Manila paper as an example. I'll show you my example here. So those are the the topics that I wanted to study more. Now, write your plan on paper or whiteboard and place it where you can see it every day. I'm talking about the plan. So my big plan is to study for 14 days. And so I break that down into how many days. So as an example, what I did was I have this whiteboard, and then I divide it on how many days am I gonna study and what am I doing on those days, and how am I gonna schedule myself on studying. So as you can see here, I have a busy schedule. I started on the 30th of May, and then I end up studying on June 12, and then I took the exam on June 13th of this year. You can see there SA, and those are my student assignment. As you can see, there's also like oncology when it says onco meaning I am working on my regular job. Right now I'm an oncology nurse, and so I work like 12 hours there, and then after that I have to do a topic 3 student assignment that I have to submit, and then every day I have to study. I commit to studying for 2 hours. That's what I do. On June 2nd, I place there, I write there wound. So wound, I'm also a one of my PRN job is wound care. So I work as a wound care nurse, and then on the afternoon or in the evening after I work, I study for 2 hours. And there's also an ER. As you can see on the 5th, I work also in the ER. So I'm my PRN, one of my PRN job is working as an emergency room nurse. After I work for 12-hour shift, then I study for 2 hours. Now, if I failed to study because I was so tired, sometimes, when you work, it's so tiring. You get home, you eat, you sleep, and you forget to wake up and study because you have to work the following day, then what I do is I build it up, and then the following day I have to study for 4 hours. Instead of 2 hours, I have to study for 4 hours. And then on the 13th, I have to take my CCRN exam. That's my big plan, and I have to adhere and follow to that plan in order to be successful. What I usually do is first I drive to the testing center. I want to make sure that I know how to get to the testing center because that's gonna cost you or me, that's gonna cost me a lot of stress or anxiety if I don't know how to get to my testing center on time. So that's what I do the day before the exam. Second, I go and pray. Bible verse that I wanted to share to you, nurses, is that it says on James 1:5, if any of you lacks wisdom, you should ask God and it will be given to you. So I asked wisdom from God. And then I rest and relax. Make sure that the day before the exam, you sleep early and you sleep at least 8 hours so that the following day, on the day of the exam, you won't get tired. You won't easily get fatigued during the exam because it's a long exam and you have to prepare physically, emotionally, and for me, personally, spiritually also. On the exam day, always remember to eat a light breakfast. Don't forget your medications because that's going to help you during the exam. Wear comfortable clothing, bring a jacket, and go to the testing site at least 30 minutes early because you're gonna have to prepare yourself. You're gonna submit yourself for biometrics, so it takes a while also. So be there 30 minutes, at a minimum of 30 minutes before the exam. Always remember on exam day that you don't rush and give at least 2 minutes per question and move forward and bookmark and answer test questions. This is very important. On CCRN exam, they would allow you to bookmark questions. So what I did was, if I am taking a long time or more than 2 minutes to read the questions and rationalize for my answers, and so what I usually do is I bookmark it. I place a bookmark. You can do it. The test would allow you to do it. So you bookmark and exam. You can go back to the questions which you haven't answered yet. Please utilize that because I did that. I used that, and it works wonders for me. Okay. Now, if needed, pause, take deep breaths, and go to the restroom. That's very important. Some of the nurses, they would say, hey, I would just, I would just wing it. And then even if their bladder is full, then they don't go to the restroom. That makes them more anxious like me. So what I did during the exam, I actually raised my hand and asked for assistance. I went to the restroom, I peed, I took deep breaths, and then I came back. And that took care of because I was like getting so sleepy, getting anxious also, because it was a very, very challenging exam. The major concepts that were tested during my exam was diabetes insipidus, DI, versus your SIDH. What happens to their osmolality, what happens to their urine and serum osmolality. Please do study on that. Bronchial tear, it came out. DIC, heavily tested there. Thrombocytopenia. SIRS, or your SIRS, versus your sepsis. When do they get to the sepsis? What are the standards? Like, you could say this is SIRS, and then you could say in this in this situation, it's sepsis now, versus MODS also. Coagulopathy labs, please do study on those. Please brush up on your memory about your coagulation normal results and abnormal results, and what does that mean when you have something elevated in your coagulopathy. Labs. Sickle cell has been tested also, breast CA, cardiac dysrhythmias with electrolyte imbalance. So what happens if you have an electrolyte imbalance of a decreased sodium, potassium, and what is the corresponding like cardiac dysrhythmias also? What happens during an heroin overdose? Intracranial bleeding, what are the signs and symptoms? Is tested also in the exam. Stroke, PVD, the arterial versus the venous. Pelvic fractures, guys. ABG, please include your basic tests. Include hypoxemia also. What are the normal ranges and what are the ranges for your mild, your moderate, and your severe hypoxemia during your ABG? Not just the ABG interpretation. Include your base excess. What happens to your BE if you're on alkalosis state, if you're on acidic state. Traumatic brain injury, TBI, is tested also. Tylenol toxicity. Sense taken's Blakemore tube, what happens, how to assess for your proper placement. Aortic dissection, it came out. ESRD versus your ARF, and what electrolyte imbalances between the two. How would you describe their electrolyte imbalances? Metoprolol overdose, kayexalate, what's the mechanism of action of your kayexalate? Why do we give kayexalate? Pneumonia, S3, heart sound, your heart murmurs, and what does your heart murmur means, and what would you suspect if you have heart murmurs? Cardiac myopathy, gastric surgery, cardiac meds, heavily tested because this is a critical care nursing test. Please do study your inotropic, your cardiac meds in totality, and what's their mechanism of action. They test your knowledge about how would you handle diversity and culture when you answer these questions. Collaboration with the team, how do you facilitate education, which is an important part of our nursing in therapeutic communication. Please brush up on those things, and those are the golden nuggets or the major concepts that was heavily tested in my exam, in my CCRN exam. So most probably it's gonna come out also in your exam. And please do, I highly suggest that you study this two weeks before or prior to your exam. Please study these concepts. The references, if you're gonna ask me what references did I use, what resources, so I am cheap nurses, so by saying that, I always, when I take exams, I just borrow resources. That's it. You can borrow from people who has took the exam also. All right, so AACN, the Essentials of Critical Care, is considered as the foundation of CCRN exam, but I've never finished that Essentials of Care because it's too much for me. And I had this, I borrowed this MedEd CCRN exam review, and I finished it. It's like a summary of your CCRN exam. And so I borrowed that from one of my friends. And as you can see, this is the third edition of Essentials, but still very valuable. Okay? So does not matter if it's, I mean, you can get the latest edition, but there would be like just maybe 5% of difference or 3% of difference. So you could still use the old essentials of critical care as your study guide. Another set of references. So as what I have told you, my plan was to study the theories, gain more knowledge on the first week, on the first 7 days, and then on the second week, I focus on answering pre-test questions. So the practice CCRN exam questions by AACN, this is 190 questions, and I think I answered like 100 or less than 100 correct answers. And don't be discouraged when you get, like, for me, it's a failing grade, right? I have 190 questions, and then I just got like less than 100 of correct answers. And I always think of that as a motivation and as a blessing. Nurses, if I can do it in 14 days, yes, 14 days with 3 jobs and doing my master's, then you can do this too. Always remember that knowledge is power.